also a tertiary hospital or health care center. This means that babies who have problems that are from other states come here to be cared for. Most of the time, pregnant women have healthy babies like these here. Today, there are about 4 babies here. After babies are born, they go home in about 1 day. These babies were born either yesterday or today.
Look at him, he's all posing for the camera. Oh.
Batteries and stuff. It's gonna fade it in. He's got a baby there. Do you see any other babies?
No.
Look at stuff.
This is the NICU or neonatal intensive care unit. Babies that are born too small or are sick come here. They get special attention and most have to stay in incubators to keep warm. They have to stay here for a much longer time than the healthy babies do, sometimes as long as 6 months. Here were some babies that were born. It says, give me a pacifier or help me suck on my hand. Here are some babies, and it says, I'm having trouble. We are now entering the Prenatal Diagnosis and Genetics Center. Prenatal diagnosis identifies babies that are sick before birth. This is the front desk. This is where people come here first. Pregnant women check in here first. This is Shauna. Shauna, what do you do?
I check in patients and schedule their appointments, look through all of them. Or when they're leaving it, they need to come back again, and basically keep the office running.
Thank you.
Steph, you're supposed to say now we go into the ultrasound room.
No.
Hold on. Come back here.
What?
Ready? Now you have to do the next part. You know what the next part is?
Yes, this is, now we're going to go into the ultrasound room.
Or maybe we should go talk to Pam first. You want to go see what Pam does? Well, she's still here. Before we go into the ultrasound room,
Pam
let's...
wants to put a pillow in and break it.
What? She can't be pregnant.
Why not?
Okay, come on.
Can I
Okay.
be pregnant now?
Before we go into the ultrasound room, we'll go into the non-stress testing room and see Pam. Hi, Pam.
Hi.
Pam is a nurse here at Prenatal Diagnosis and Genetics. So, Pam, what do you do?
Well, we do non-stress tests on these beds here, and we listen to the baby's heartbeat to see how well the baby is doing at the time, and we can look and see how much fluid is floating around the baby at the time, and if the lady's ready to deliver, then we send her over to labor and delivery, and she has a baby.
Thanks. Now we are in the ultrasound room. Here's where we will meet my dad, or Mr. Pursuit. Hi.
Hi.
Dad, Mr. Pursuit, what do you do here?
Well, I'm called an ultrasonographer. And what that means is I take pictures with this machine here. What we do is we have patients come in, they lie down on the table just like where you're sitting, and I take this little handheld probe. It's called a transducer, and I rub it over the surface of your skin, and it gives us pictures up on this screen of what's inside you. Most people who come into here are pregnant. So we get pictures of pregnant babies, or pregnant women. Not pregnant babies, pregnant women. Babies inside pregnant women. To do this, what we do is have you lay down. Go ahead and lay down for me. Then I take and put some of this gel, this goo, on your belly. And I rub this little transducer over the surface of your skin. Now, I'd normally be doing this on your belly, but since that's not accessible, we're going to do it on your skin here and rub this across. It gives us a picture like this, and we're going to show you in a little bit a picture of what an exact ultrasound looks like, both a regular ultrasound of a fetus and also a three-dimensional ultrasound of a fetus, and hopefully you can make sense of it. And what we do, when we do the examination, we get measurements of the baby's head, its waist, and its thigh bone, and we try to figure out how old the baby is based on those measurements. We also should have a pretty good idea of how old we think the woman to be when she comes in for the ultrasound examination. And we compare how old the baby is based on its size with how old it should be based on other things. And we can tell if the baby's big or small or has a growth problem or not. After we get done measuring the baby, then we take a look at its anatomy. We look at its brain, and we look at its spine, and we look at its stomach. We look at its kidneys and its bladder. We look at the umbilical cord and the placenta. We look at all of those things to see if they look normal. Now, most of the time they're normal, but sometimes they're not normal, they're abnormal. And when they're abnormal, then we have to give bad news to the mother. Sometimes there are things that we can do about it when it's abnormal. Other times, we can't do much about it at all except wait until delivery and then maybe do an operation after delivery or something like that. So that's kind of the gist of what I do.
Okay, thanks. What types of things do you see on there?
Well, besides the things that I mentioned, we can also see things like the upper lip of the baby. We can see the baby's face. We can see eyes. We can see ears. We can see nose, mouth. We can see the heart. You know, how many chambers does the heart have? How many spaces does it have? It has 4, doesn't it? 2 ventricle and 2 atrium, right? And we spend a lot of time, since heart problems in babies are among the most common problems that we run into, we spend a lot of time making sure that the babies have good, healthy, sound hearts. When we do identify a problem with the baby's heart, there's a much higher chance that the baby will have other things going on. So it's an organ that we're going to look at really closely to see whether it's normal or not, because that might give us some information about whether the overall baby is normal or not.
Thanks. And that about wraps it up for this video of the hospital and all the ultrasounds. Thanks for watching.
Hold on, I gotta go to VCR.
It's recording.